Welcome to Beyond the Mask. I'm Sharon Pierce, and today we're bringing you something special, a live taping from the West Virginia meeting with a leader who has a front row seat to where our profession is headed. Joining me is Jeff Molter, President of the American Association of Nurse Anesthesiology. In a moment when healthcare is shifting fast, payment policy, scope pressures, workforce strain, and evolving care models, having a clear direction and unified advocacy isn't optional, it is essential. In this conversation, Jeff will walk us through the AANA's current priorities, major initiatives, and strategic direction, and more importantly, what those moves mean for you on the ground, your practice, your professional growth, and your voice in advocacy. We'll also dig into key policy, legislative, and organizational updates straight from the President and break down practical ways every CRNA can plug in. Whether you're new to involvement or ready to take your engagement to the next level, you need to listen to this. So if you've been asking, where is the AANA taking us next? What's happening right now that affects my work? And how can I make a real impact? This episode is for you.
CRNA Financial Planning is a sponsor of Beyond the Mask podcast. Investment advice offered through Private Advisor Group. Nothing in this podcast should be construed as investment advice. Plus, did you know listening to our podcast can earn you Class B credits? For details on how to submit, visit the CE credit section at beyondthemaskpodcast.com. Welcome to Beyond the Mask, innovation and opportunities for CRNAs and advanced practice nurses, with certified financial planner Jeremy Stanley and CRNA Sharon Pierce. Jeremy Stanley has worked with CRNAs for more than 23 years, and Sharon Pierce is a former president of the AANA and the NCANA. Join us as we leave the operating room and learn the latest in the CRNA and advanced practice nurse industries. Beyond the Mask starts in 10, 9, 8, 7.
Let's get started with AANA President Jeff Molter. Thank you for joining us today, Jeff.
Thank you for having me. Thank you.
You're a repeat offender. We've had you on several times.
Yes.
I just wish we had some wine up here while we were doing it. But we'll be having plenty of that tonight as DJ Pierce DJs our party. Why don't you tell them what just happened here at this meeting,
Yeah, so
Jeff?
here at the West Virginia Association of Nurse Anesthesiology meeting, and Richard Wilson was giving an excellent talk on pharmacology, and the fire alarms went off, and they came in the room. We weren't sure if we should get up or leave, but there was a major fire alarm here, and someone came in and said, yeah, this guy that's DJing this event tonight was using his smoke machine and triggered a smoke alarm. Well, that DJ is DJ Michael Pierce. Yeah. So,
well, we'll be telling this story for a long time to come. Well, Jeff, today we're going to talk about where we are as a profession, where we're headed, and what it takes to lead more than 67,000 CRNAs and students across this country. So we'll start big picture. So, Jeff, I want to ask you, what is keeping you up at night?
Oh, boy. It's a loaded question. Yeah, and what keeps me up at night are some of the stressors on the healthcare system, especially when it comes to CRNAs and SRNAs. The big thing is reimbursement. Obviously, we all know that maybe 2 years ago, Cigna cut reimbursement to CRNA-provided care, QZ billing, 15%, and what seemed like something small has led into something much larger than that. Since, the federal government did not enforce the law with Cigna, other insurance companies jumped on board, including Medical Mutual Ohio, United Healthcare, Blue Cross and Blue Shield. They're all cutting us 15%, and that is a major stressor because, we need to be reimbursed fairly for the work that we do. And when it comes to putting in an epidural or giving someone anesthesia, whether I do that or a physician anesthesiologist does it, we're using the same medications, the same techniques, we studied from the same books. why would I be getting reimbursed 15% less? So that is a major stressor. Do you want me to go on?
Oh, well, I've
Oh,
sat in your
okay.
seat before, so I know
Yeah.
that there are more. But before we go on, and yes, I want to hear more about this, but we used to say, and you get your sound bites when you're president that
Yep.
you know that they're going to pick up on, and this is a long-standing problem. But I used to say, pay for the degree of the care, not the degree of the provider, right?
Absolutely.
We're doing
Yep.
exactly the same thing.
Yep.
But a bigger question to me is, I'm sure that our physician colleagues in their professional organization aren't coming out saying, that's wrong, even though with QZ billing, it's going to harm,
Yes.
right?
Yes.
Because 85% of us function in an ACT environment, and when they get cut 15%, that means that whole business plan gets cut 15%. Am I wrong or right here?
No, you're right. And when it comes to reimbursement policy, this is one area where I think the AANA and the ASA should stand together on, getting paid for the services that we deliver. Unfortunately, the ASA delivered an amicus brief to a federal court when we're fighting this case, saying that they agreed with the 15% cut. At the end of the day, the federal judge said that their letter really didn't add to the argument or take away from the argument, but just shows you where they stand on the issue, I guess.
So what else is keeping you up at night?
Oh, well, the United States Department of Education decided that we didn't belong in the professional category. So late last year, they declared that they were going to cap SRNAs or CRNA residents at $100,000 of loan money borrowed from the federal government. Unfortunately, they're limiting them to $20,500 per year. And as most of you in the room know, your CRNA program is usually 3 years continuously. So that literally comes out to limiting you to $61,500. And this came from the Department of Education, from the big, beautiful bill. The AANA, we've been fighting that. I want to thank all of you in this room that wrote letters to the Department of Education. We had over 5,600 letters that were written in a 31-day window, which is a great response from us. I also believe that, we asked you to write letters to your congressmen and senators to get them to sign on to a letter that was going to go to the Department of Education. I believe we had over 160 federal legislators that signed on to that letter to the Department of Education. So that 31-day window where there's public comments is done. So now it goes back to the Department of Education where they need to make a final rule or a final decision. We're hoping that they change us to the professional category and raise that limit to $200,000. Nevertheless, you said it earlier, Sharon, we are CRNAs, we're strong, we're resilient, and no matter what people do to us, we find a way. And at the end of the day, this is federal student loan money. If that's cut, we will find other ways to work with SRNAs and students to make sure that their education is funded because, you guys are our future and we need you guys, and we'll find a way to get your education assistance and paid for. So
Absolutely. Well, Linda Williams, she was known for her famous quote, students are 10% of our numbers and 100% of our future. Now you see why she was my mentor, don't you? She was brilliant. She's also an attorney. But, sometimes out of one door closing, I guess opportunities may arise. And I've been catching wind of hospitals who are saying, we'll pay for your education. You just sign on to work here. And that means you would come out maybe with no debt, right?
Absolutely.
So I could see that this, with our resilience, could come out to be a better deal. How would you like to come out with zero debt versus a six-figure debt load? Because we are a needed workforce.
Yeah.
We are the workforce, for God's sake, right?
100%. And if I could add, too, I told a story earlier how I really wasn't involved in advocacy when I first came out of school. That was, again, I belonged to the AANA, but I didn't give to the PAC. I wasn't involved. Hey, the older CRNAs, that's their problem. That's not my problem. But one of the things about the education funding, I think that's helped engage our younger audience. That's engaged our SRNAs. You guys see the work that we all need to do. We all need to work together. I mean, we're one profession. I mean, is the education funding going to affect me as a CRNA? No, but I believe in the profession, and it's the right thing to do to fight for all of us. And so again, I think, maybe the bright side of this is it opened up the advocacy eyes for maybe our younger SRNAs and our younger CRNAs.
I like that. I think you could be right about that.
We'll see.
These guys in here look pretty darn engaged.
Absolutely.
Yeah. So what else is keeping you up at night? I learned a long time, you don't look at your phone before you go to bed, do you? My husband, every single night, I'd pull my phone out. He goes, no, don't, because I'd look at it and I'd go, oh, he'd go, is it blankety blank? Oh, is it blankety blank? What's happening?
I mean, this is a massive organization. As we talked earlier, I mean, we have 50 state CRNA organizations. We have the AANA, which oversees the entire country, and every little state has a battle going on, whether they know it or not. I don't know. I mean, the funding, the reimbursement, the education funding are the top two. I hate to bring up the VA because we've been working on this VA situation for...
It was supposed to be put to bed my year.
More than a decade. And for those of you that are younger in the room that may not know, the Veterans Administration is essentially the largest healthcare system in the country. Several years ago, they revised their handbook on advanced practice nurses providing care in the VA, and all the advanced practice nurses were granted full practice authority except who? CRNAs. We were not granted full practice authority within the Veterans Administration, which boggles my mind because there are CRNAs in the front line in the battlefield providing anesthesia care to our soldiers. I mean, there's no physician anesthesiologist. There might be no physician within 2 countries away, and they're providing care, but they want to work in the VA, and somehow they need to be supervised by a physician. We've been making little cracks and kinks at that. We've been marching along slowly. Jan Setner and I met with the Veterans Administration in January of last year. We thought it was going to be a very positive meeting because we had a new administration that was coming in that's all about cutting red tape. And what a perfect way to cut red tape, right? Let's cut the red tape. Let's let CRNAs practice the full scope. The meeting went pretty well, but they really still were hesitant about moving forward. I will say that, they want studies, they want data, and I believe we have a study that's coming out soon that was in the Veterans Administration, and some of the early findings are that patients had better patient satisfaction when CRNAs delivered the care. Shocking, there were no difference in the results, the outcomes of the anesthesia, whether it was delivered by the CRNA and anesthesiologist or the two of them working together. So keep your eyes on the lookout for that study, but I think that's going to be big.
Well, you do know why physician anesthesiologists are not on the front line, what their organization said, Jeff? They are too valuable.
Oh, yeah. Yep, of course.
I know, I see a lot of eyeballs popping out there, but they are too valuable. That's why they do not serve on the front lines, and that's why it's all CRNAs serving at the front lines. So there's a lot going on at the federal level. You showed the slides today in your update. Mm-hmm. We've got more people in our shop in D.C. than we used to have.
Yeah, absolutely.
Even though I will say that our counterparts have 3 times as many people. So what we accomplish is Herculean, but we do have more people in our office up there now.
Yes, I think we have 10 people working in our office in Washington, D.C. As I said earlier, we have an office in Chicago. We also have a federal office in Washington, D.C. And if you go to mid-year assembly, they sometimes will do a little PAC fundraiser in the office there. It's usually a little side fundraiser. If I'm sure they'll be doing something this year. They always do.
So what can nurse anesthetists out there do to actually influence federal outcomes?
Well, I'm not going to beat around the bush. I think giving money to your state and federal PAC are number one. I think that's just the way the game's played. I showed a slide earlier of the top medical PACs in the country. We all saw who the first one on the list was. They've been in that position for a long time. And I'm not saying that we have to have more money than them, but I say we have to get close to the amount of PAC money they have. So that's number one, give money. And, we're CRNAs. We make a good living. We make a 6-figure salary. I honestly, it boggles my mind that some CRNAs are unwilling to give $50 to their state PAC or $100 to their federal PAC. I mean, this is your insurance. You're insuring your profession that it lives on. I'll tell you, being in the position I'm in, I remember going back in Ohio, and when we won this legislative battle in order to prescribe or write orders, you have this like little victory lap, but you're like, know what? One thing happens and another thing's going to come along. So like this is an infinite game. I know you're a big fan of Simon Sinek. He wrote a book about infinite games. I think being a CRNA, this is an infinite battle. Like we're talking about insurance companies cutting us 15%. What's stopping them from cutting us 20%, 25%? What's preventing them from reimbursing us for our services? I had a surgeon reach out to me last week. He's like, I did a colonoscopy on a patient. Insurance is refusing to reimburse the anesthesia that was provided by a CRNA. I mean, this is an infinite game, and it's always going to be there. So we always have to be engaged.
Exactly. And along those lines, we have a lot of students in here. Always be a member of your association. And when you look at how much being a member costs versus how much money you make, it's like 0.001% or something. Now, listen, my program director put the fear of God in me. I think she had me microchipped, and I would be afraid not to be a member of the AANA, but I want to impress upon you, without the American Nurses Association, there would still be nurses. Without the American Association of Nurse Anesthetists, there would not be nurse anesthetist. Okay, this is your insurance policy. You pay more for your car insurance than you will to be a member of this association. You'd be afraid to go without car insurance, right? How many of you drive a $250,000 car? Nobody, right? But you'll insure your car, your $60,000 car, but you won't insure your $250,000 salary. It's ludicrous. You need to insure your profession. Don't ride on somebody else's coattails. People are riding on my coattails. They're riding on Jeff's coattails, the people who will work for your association. Get your insurance.
Yeah, there's that, is it the Maslow hierarchy of needs, and the very founding block is like safety or whatever. For me, like the founding block of being in the profession is being an AANA member. The AANA, listen, we're not perfect. We make mistakes, but at the end of the day, we're trying to represent our members to the best of our ability. And as I said earlier, you pay to be a member, and some of that money comes back to your state. Your treasurer gave a report earlier. That money is coming back from the national organization to your state, so you guys could fight these fights at the state level. And congratulations for removing supervision in West Virginia. That is monumental. I don't know when that was put in place in West Virginia, but I could tell you in Ohio, that's 1917. I believe we're the first state in the country where supervision was put into the law. So congratulations, West Virginia. That is monumental, and I feel blessed to be in the room when you guys were celebrating at your business meeting. What a cool time to be here. Mm-hmm. What a cool time.
Absolutely.
Are you a resident or CRNA looking to transition into independent practice? The AANA and Beyond the Mask are here to help you thrive as your own boss. Introducing the 1099 CRNA Institute, taught by Beyond the Mask host Jeremy Stanley and Sharon Pierce. This comprehensive educational series provides detailed guidance on business structure, legal and tax implications, and financial management tailored specifically for 1099 CRNAs. Lean into the feeling of freedom and embrace the opportunity to be your own boss with the AANA as your partner on this exciting journey toward independence. Enroll now and earn valuable continuing education credits as you chart a new course in your rewarding career. Visit aana.com/1099 to learn more and take the first step toward your new future. The 1099 CRNA Institute. Thrive as your own boss.
Okay, well, let's talk about the anesthesia workforce. Now, how many people in here read Becker's Healthcare? You know what it is? Yeah. We just interviewed Scott Becker last week. Always an interesting interview, and you guys will be hearing about it on the podcast. He's got a new book coming out. And by the way, if you pre-buy his book and send a text to him, he'll send you an Amazon gift card to cover the cost of buying the book. It'll all be on the podcast, and it's talking about making your businesses great. There came an article called The Anesthesia Workforce Shortage Demystified, and they talk about the physician shortage, the CRNA shortage, and those types of things. So where do you think our shortages are coming from? I think it's multifactorial, but I know that the AANA is addressing on multiple levels.
Yeah, I agree 100%. I mean, when I got out of school 20-some years ago, surgery centers were just starting to pop up. All anesthesia was usually given in a hospital setting. Ambulatory surgery centers started to pop up. Oh, what came next? GI endo centers start popping up. What popped up next? Eye centers. So you start opening up all these facilities, and all these patients need anesthesia services. So the expansion of procedures that require anesthesia has gone up significantly. The workforce, I could speak on our side. When I graduated from school in 2000, there were about 88 CRNA programs in the country. I was at a presentation last week, and I believe there's 150 CRNA programs in the country right now. So, almost double from 25 years ago. And there's also, I believe, 15 more opening in the next year. And if you just run basic numbers, 150 programs, if the average class size is 20 CRNAs, we're putting out at least 3,000 CRNAs a year right now. And I believe the physician residency is capped for anesthesiologists at 1,800 to 2,000. So, we're producing more providers at this time than they are. And if you looked at the statistics in that article too, it said that anesthesiologists had less job satisfaction. They were leaving the profession sooner.
44% of them want out.
Yeah. So, I'm sorry you went to medical school to learn a nursing profession, but
snap.
Well, I mean, yeah. There's your quote.
That's your one-liner.
Yeah,
I love it.
Sorry.
I love it.
But honestly, from a numbers perspective, in the next 5 to 7 years, we are going to outnumber them significantly. So these years of the ASA not wanting to talk with us, not wanting to deal with us, not wanting to recognize us as being full practice providers, I'm sorry, guys, it's coming. You're going to have to deal with it at some point. And AAs, that is not going to be a solution to your problem. So.
Yeah, before World War II, it was 17 to 1, 17 CRNAs to 1 anesthesiologist. And we're trending back. So I guess we need to talk about models then, and how we are seeing the models change, going to CRNA only at different places. Would you like to address
Absolutely.
that?
Yeah, I showed the website earlier, anesthesiafacts.com. We talk about EDAM, or it's our efficiency-driven anesthesia modeling, where, it basically just puts numbers in front of you and it basically says, you want to run 10 ORs. How would you like to run those 10 ORs? Do you want 10 physician anesthesiologists? Do you want 10 CRNAs? Do you want a combination of CRNAs and anesthesiologists? But it does not take a rocket scientist to figure out that, the more physicians you have, the higher your costs are going to be. And are your outcomes any different? Well, there's no studies out there showing that the outcomes are any different no matter how many physician anesthesiologists you have out there. What I think is interesting in anesthesia care too is, I've been a CRNA for all these years, and, 25 years ago, you have a difficult airway, you want someone around that has an extra pair of hands. So in anesthesia, I feel like we've always had this tendency to be, I would say, overstaffed. And do we see surgeons doing that? Do you see a surgery center where you've got an extra surgeon floating around just in case a surgeon has a problem, they could jump in the room and help? If you want to be efficient, you have 5 ORs and you have 5 providers giving anesthesia to 5 people. Is it convenient to have an extra body out there seeing the patients, putting the blocks in? Yeah, it's convenient, but is it cost effective and is it necessary? And of course, every facility has their own inputs and outputs, and they have to look at the numbers. But you're right. The models are definitely changing.
Mm-hmm. In our favor.
In our favor,
In our
absolutely.
favor. Absolutely. So we also see a lot of CRNAs going 1099, and we have an institute within the AANA saw a void and filled that void because we weren't educating. You're not educated students how to set up your own business, how to file your taxes, all of that kind of stuff. So the CRNA saw a void there and set up the 1099 Institute, and you saw the future coming and that CRNAs are going more 1099.
Yep.
And part of that's a generational thing too, I think.
I think so, yeah. More control over your work schedule, more control over where you're going to work or where you're not going to work. 1099 is great. I work as a 1099. Again, you have control over your own schedule. You typically make a higher hourly rate. You can negotiate like an 8, 10, 12-hour minimum. It's great, but there are some pitfalls to being a 1099. Obviously, you have to pay your own medical health plan, your own malpractice. If you want to take a 2-month vacation, go for it, but you're not getting paid, right?
Only eat what you kill.
That's right. That's right. So if you're a W-2 employee, you might make less hourly money, but your health insurance is usually subsidized. You might have 6 or 8 weeks of vacation. You go to Hawaii for 2 weeks and you're getting a paycheck still. If you're a 1099, you have to plan for those things. And I'll tell you, COVID was a big eye-opener for a lot of 1099s because during COVID, a lot of facilities said, hey, you're 1099, we don't need you for 6 months. 6 months, we don't need you. So I hope you have some money saved up to cover your expenses or your expensive car or whatever you have. So 1099 is great. I'm a 1099, but just know that please educate yourself, whether it's through the 1099 Institute with Sharon and the AANA or some other mechanism. But 1099 is great. I also would say that if you're at 1099, please still have some pride in your work and stuff because and this is individualistic. It's not just if you're 1099, but people will come into a facility and they're like, I'm only here for a day, and they don't restock their cart and they leave a mess and they trash the place. And it's like, people will remember that about you. And the anesthesia community is very small. So, if you're 1099, you're working as a contractor, just please take some pride in your work because again, your name is on that work that you put out.
Be careful who you hire. I hired my husband as my CFO, and I had to fire him. That was a really interesting day.
The same day? Oh,
no, I waited a little while, and then I fired him.
That's hilarious.
Well, let's talk about history, and you have a particular love of history of the nurse anesthesia community. So why don't you share why that is and what's coming down the pike?
Well, I mean, it's funny. I grew up in Northeast Ohio in Cleveland, which is, where the AANA started. I had none of this knowledge. My grandmother was a LPN. She worked in the operating room when I was in high school. She's like, you should look at this profession, CRNA. Never heard about it, didn't know about it. Back then, no internet, no Google. This is 1987. Looked at an encyclopedia. This looks interesting. Went to college, went to nursing school. Played on the men's soccer team at Ohio Wesleyan, where all my teammates told me to pick up my skirt every time I was going after a soccer ball, jokingly. But fast forward, and my ICU job was at University Hospitals of Cleveland, which is attached to Lakeside Hospital. And I later found out that, oh my God, Lakeside Hospital, like this is where the AANA started in 1931. This is crazy, like right in the hospital where I'm working as an ICU nurse. So ever since I found that out, I just have looked at the history of Agatha Hodgins and the things that she's done. I mean, she's an amazing human being. To think that she was doing these things in the early 1900s, women didn't even have the right to vote. And she's running an anesthesia school. She started the national organization. She went over to France during World War I. She was teaching physicians and nurses how to give anesthesia, along with George Cryle. I mean, a pretty incredible woman. And I don't think that Cleveland honors her legacy the way that it should. I mean, we have statues of athletes in Cleveland. I mean, great. I mean, these people played they made millions of dollars and they did their job, right? Agatha Hodgins was probably making pennies on the dollar back then and doing what was right for people. Really cool. In Ohio, we have the Ohio Historical Marker Society, and there's historical markers all over the state, but you have to apply for the marker. You have to find someone to donate the property to put the marker on. They have to agree to a contract that's in perpetuity that they're going to take care of that marker for the rest of time. And really cool. Hathaway Hester, who's our archivist at the AANA, she filed the paperwork to get this historical marker put up at Lakeside. University Hospital CEO, Cliff Majerian, a shout out to him. He's an ENT surgeon. I brought the idea to him. He was all behind it 100%. University Hospitals has agreed to put this on their property at Lakeside Hospital. And the plaque is being made right now, and we're hoping that it's installed and we have a ceremony later this year. So when that happens, we will put that out to everybody. We're probably going to have a big ceremony there at Lakeside Hospital honoring Agatha Hodgins and her legacy. And maybe years from now, we could put a statue at the original Lakeside Hospital, which is no longer exists. So
I will be there.
Please.
When I first got on the board, I was a very active member. I had served on committees, and I knew we had a really neat organization. And then when you get a peek behind the curtain, like the Wizard of Oz, it's like, holy cow, what an amazing organization that we have. We have 140 people who work for us, and 136 of them are not CRNAs, and they are as passionate as they can be for our profession. But outside of that, what has surprised you the most?
Oh, it's an incredible privilege to be in this position. You know, there's a lot of responsibility, but I love the profession, and I love being in this profession and giving back, and what ultimate way than to be in this position. But a couple surprises. I said earlier that I've been very fortunate that we have a board of directors. It's been unbelievable the last 6 months. And as I said earlier, you guys elect people to be on the board of directors. When you start a business, you handpick people that you want to be on your team. When you're the president of the National Association, the CRNAs are picked by you guys to be there. So, and I'll tell you, you guys did a great job because this board has been phenomenal. They're all working very hard. We're doing the best that we can. We did a strategic planning session. We're looking at moving this organization ahead for the next 10 years. So I've been very fortunate to be on a good board. I'm surprised, how much people respect the position. And people will they'll respect me because I'm in this position, even though you don't know me from Bob, Adam, or Steve. So it's very kind of people to maybe give you more respect than what I feel I deserve sometimes. But also surprisingly, some people will send me email. It's not so flattering.
I've gotten some of those too.
I mean, we have 70,000 people. We had some social political events that happened last month, and I had, people on both sides of the political spectrum, emailing me, telling me, I should be doing this, you should be doing that. And again, I'm the chair of the board of directors. The board of directors makes the decisions, not
You don't
Jeff
even have
Molter.
a vote unless...
I don't really have a vote unless people tie. So I really feel that my role is mentoring the board members and putting them in a position where they all could be future presidents of the AANA. And I've said that to them since the first day that we had our orientation. They're the future of the organization as well. So
as we kind of wrap up here, anything you would like to leave our listeners with?
I don't want to beat the dead horse, but, just being an AANA member is really the founding brick of this profession and protecting what we have. Being a CRNA, this is going to be an infinite battle. And for you younger CRNAs, think about legislative changes that could come down the pipe that can affect you significantly. What would happen if RNs start pushing propofol in GI labs? What happens if PAs start giving anesthesia, which we've seen some states try to push through? In Ohio, they tried to push through some legislation where they were calling them advanced respiratory therapists. They were going to allow anesthesiologists to delegate anesthesia to them. These things are all probably in the future, and it makes it that much more important to be a member of the association, to give to the PAC so that we can, advance this profession together. We're in a great profession. We make good money. We do a great job, but just know that in some respects that can put a target on your back. And, whether it's the CEO of the hospital, the people in the C-suite, they're going to look at ways to solve some of these shortage problems, maybe by using people that aren't us. So,
Well, this year, 2026, is the 40th anniversary of CRNAs getting third-party reimbursement. And at the Congress, you guys are having a forum of three. It went through 7 AANA presidents before it came to be, right? And some of them are dead, but 3 of them, who are clearly alive, okay, are going to be on this forum, this panel. And it's going to be Monday at the annual Congress at 4:00. And you need to be there to listen to these people who were in the room when these decisions were made and who made this happen. And these are the people who made sure that you make a good living wage now. If we would have not achieved third-party reimbursement, we would be extinct, or you're basically an AA and working for whatever they give you. So this is an important talk, and it is important to see the people who made this happen. So if you're listening to this and you're going to annual Congress, make sure you're there Monday at 4:00 to witness this, because we'll be sitting on the front row, won't
history. I'll be there.
Absolutely. Yeah. What I would like to say about Jeff is I have known him a long time, and he leads with heart. And that's sometimes hard to do because it can get stomped when you lead with heart. And, when I ran for public office, I was a target, and they did commercials, things about me all the time, nastiness. And you know what? I could take that. But when your own people come after you, now that's hard to take sometimes. That's when you sit in this seat. And I will tell you, leading CRNAs is not an easy business. But I used to have to tell my board, what makes us good makes us bad, right? We're strong. We're opinionated, assertive to the point of being aggressive. But that is exactly what makes us good at our job, right? It doesn't necessarily make us good to each other. It doesn't necessarily make us good to our partners. Sometimes my kids tell me all the time, Mom, this is not a board meeting. Quit telling everybody what to do. But it makes us hard to lead. So just keep that in mind. So I want to tell you, thank you for everything you're doing, Jeff. Thank you for your leadership. Thank you for being here with us in Morgantown, West Virginia. Leadership in this profession is not theoretical. It impacts reimbursement. It impacts scope. It impacts access. And ultimately, it impacts the patients who trust us every single day. What we've heard today is that nurse anesthesia is strong. But strength requires vigilance, just as Jeff said. It requires engagement. It requires CRNAs who understand not only how to care for patients, how to find those vocal cords, how to maintain a mask airway, even though that is what you get paid for, right? Maintain that mask airway and the airway in general. But it's also how policy, economics, and advocacy shape the environment we practice in. For those of you in this room, students, early career CRNAs, seasoned clinicians, yes, I'm looking at you, Deb Kearney and Tammy Cunningham, the future of this profession is not something happening somewhere else. It's happening here. It's happening with us, through us. So, Jeff, thank you again. Thank you all for being a part of this conversation, and I think it's a wrap.
Thank you.
Thank you for tuning in to Beyond the Mask. If you enjoy the show and want to help us grow, the best way to support us is simple. Leave a review on your favorite podcast platform, share the show on social media, and tell your friends. Your word of mouth is what keeps us going strong. We're proud to consistently rank in the top 50 medical podcasts nationwide and to be number 1 in the CRNA community. All thanks to listeners like you. Your support helps us stay there, and we couldn't do it without you. We'll see you on the next Beyond the Mask.